The nature of doctor-patient relationships gives us access to information about patients' lives that is not often available to anyone else. Sometimes we may become aware that patients are being abused or have been abused in the past. As doctors, we have special obligations in relation to reporting abuse, which may at times override our obligation of confidentiality. These obligations are especially relevant in relation to minors, vulnerable people, and prisoners. If we believe or have reasonable grounds for suspecting that a child is being harmed, has been harmed in the past, or is at risk of harm through sexual, physical, emotional abuse or neglect, we must report this to the appropriate authorities without delay. Where adult patients disclose historic abuse, we should assess the current risk to the patient, or to any other child or adult who may be in contact with the alleged abuser. We should be particularly alert to the possibility of abuse of vulnerable persons. For example, someone who has physical, intellectual, or mental disability and is incapable of independent living, and notify the appropriate authorities if we have any concerns. Prisoners are especially vulnerable patients. They have a right to the same standard of care and treatment as others, and we must respect their confidentiality with due regard for safety and security. If we consider that anyone is at risk, we should report this to the appropriate authorities, preferably with patient consent.